Hi, I'm Vicky, Principal Dentist at Torres Park Dental Practice. Today I want to give you the most important advice that there is, and that's prevention. Prevention is always better than cure, and it is exceptionally important at this time when we haven't got the normal access to dentists. So we're going to start with looking at toothbrushing. Most people are very much aware that we should be brushing our teeth a minimum of twice a day, and that we need to be doing it for 2 minutes each time. But not everybody is aware that we should be brushing last thing at night, because that's the most important thing, so just before we go to sleep. Because what happens is our salivary flow reduces and we don't get those natural buffers that are there to help protect our teeth during the day as we're sleeping. So it's really, really important that we brush our teeth last thing before we go to bed. And the other thing that is really important is to use a fluoride toothpaste. This has a whole load of benefits, but the biggest thing is it has scientifically been proven to stop holes in teeth or to reduce the amount of holes in teeth. So whatever toothpaste you're using, even if you want to use a different one during the day, last thing at night, please make sure that you are using a toothpaste that has got a good level of fluoride in it. Now, it varies from different ages as to what amount you need, and all of that again is on the sheet that accompanies this video. But you need to be looking for one that's got about 1350, so 1,350 parts per million of fluoride in it. And that always says on the back of the tube of toothpaste how much is in there. The other important thing is when we brush our teeth, we want to spit out at the end, but not rinse out. So we don't want to be rinsing around with any water or mouthwash. It's great if you want to use a mouthwash at a different time of day. After eating is a good time for that, but not after we brush our teeth, because otherwise you've done all that hard work of putting all that fluoride and cleaning all that debris, and then you wash that hard work down the drain. And I hate to see hard work being wasted. So that's another really important top tip for you there. When it comes to brushing our teeth, people are normally surprised. I don't mind if you use an electric toothbrush or a manual toothbrush, because you can do a good job with both. But my top tip for you is use one with a small head on it. People are normally surprised when I show them the size of toothbrush head that I would use or recommend. And for an adult, that is the size. Okay, so a really small head so that you're getting into the nooks and crannies. Toothbrushing technique. It varies a little bit for electric and manual, but we're going to talk about manual today because most people have got access to one of these. So with my lovely big teeth here, what you're aiming to do when brushing the teeth is do a nice 45-degree angle onto the gum and do little circles round. And that way you can see that those bristles on that brush are getting right into that gum margin, and that helps to stop any gum disease or to reduce the bacterial load that contributes to the gum disease. But it's also cleaning the surface of the tooth. The teeth have 5 surfaces, so we know that we're going to get a good one going around the outside, and then when we go on the inside. And when I do the bottom teeth, I advise people to flip that toothbrush up 90 degrees, so it's a smaller surface area again, and it gets right into all those nooks and crannies. And don't forget the biting surface, give that a good clean too. Okay, but little circles is fantastic. If you've got an Oral-B electric toothbrush, it's normally doing the circles for you. So the tip with any electric toothbrush, don't push too hard with the brush, but start again, 45-degree angle on the gum, and this time you can work that toothbrush up from like the gum all the way to the top biting surface, or on the top, from the top down. Okay, so we said we've got 5 surfaces. Toothbrushing has got 3 of those really well. What are we going to do about the other 2? So those are the ones that are in between the teeth, and that's that dreaded swear word, floss. Floss is absolutely fantastic, or tape, whichever, for getting in between the teeth. If we can get in there, we disturb the bacteria, we're less likely to have holes in the teeth, and we're also going to help keep those gums healthy. The other thing, the product that I absolutely love, are the little interdental brushes. Okay, and these come in a range of sizes, so pick one that fits the gaps. People often struggle with using them to start off with. The trick again with these is to aim right down at the gum level. At this point here, that's where that gap is the biggest. So aim right at the gum level, and you want to pop it in, give it a good wiggle around, and then take it out. For those who struggle with the small ones, they have got brushes with long handles as well, just to help you get into all those really difficult to reach areas. But the more we get in there, The more we are brushing the teeth, like a minimum of twice a day, doing it for 2 minutes. 2 minutes is quite a long time, especially with kids. If you put on a favourite song and get them to brush their teeth and have a dance around whilst doing their teeth, it's a really good way of encouraging them to do things. When you brush your teeth round with a fluoride toothpaste, remember to spit out, but don't rinse out, and that leaves all that fluoride to help protect things. And then lastly, get in between the teeth as well. If you want to use a mouthwash, like I said, use it at a separate time. The best time is after eating, because what you do is you have a good rinse round, and it gets rid of any food debris, helps neutralise the acids, and again helps protect against holes. But you don't need the mouthwash. The important bits and the tools that you need at home are your trusty toothbrush, your fluoride toothpaste, and something to go in between the teeth. Thank you. I hope you're all taking care, and I look forward to doing my next video for you.